This is what's really interesting. The majority of us, and I think I said earlier, 80% of us are slightly varus. Okay, you're a bit varus.
No, only on one side.
Okay, well, that's the one.
The one that's been replaced. The one that's been replaced is straight. The normal one is.
That's
now
right.
is
That's right. That's right. Well, that's what I'm saying.
Half a pig, isn't it?
You see that as you walk in. So you think. Anyway, so you're a bit varus to start off with, and so you chewed up. I expect you chewed up the inside of your knee, medial aspect, and so he's absolutely right. A degree of mechanical malalignment will accelerate the wear on the inside of the knee if you're varus. So it's rather like, if I explain to patients, I say it's like having a car tire and putting it on wonky, and that means you wear quicker on the inner treads, whereas your outer treads are just perfect. Why do a total knee? Okay, so and then to his point, then valgus knees will wear on the outer side because that's where all the pressure goes up. Now, in terms of percentages, he's also right. Laterals are much less common than medials. So about 15% of our arthritis is lateral arthritis. And there are some surgeons who say you can't do a partial on the lateral side, but it's just a more complex operation. So some of my happiest patients are lateral partial patients because we can get them, we can realign them, we can put the lateral in. It's just a lot more fiddly operation.